Hello, and welcome to this three-part series where we're going to be discussing curriculum development and integration and maintenance, specifically as it relates to the advanced pharmacology training of nurse practitioners, not only for today, but for the future, and that align with the new standards that we're all going to be faced with. I'm Dr. Bustai, and if you're watching this, it's probably because you're either involved in teaching this course to NPs, you're involved in the curriculum development, an academic environment, or you might even be a preceptor in the clinical environment, and you're wondering how are you going to incorporate and build this into your daily practice. We're going to answer all those questions, and we're going to make this very easy for you. Okay, we broke it up into a three-part series. Obviously, each part progresses, and it's important that you try to listen to all three of them so that you get the basis for where we're trying to lead you, which is how to do this. And we're going to make it easy for you, okay? So this first part is really dealing with change and why it's imminent, okay? When we're thinking about curriculum, you know that you have to design a course and it has to integrate into a curriculum. But you also have to evaluate it. Is it achieving the results that you want? And then you have to do something else, maintain it, okay? And if we're moving to an advanced pharmacology curriculum that is comprehensive, integrated, and longitudinal, there are some very practical things that need to be considered. As it relates to the design, we have to stop and get oriented, okay? And we have to stop and ask ourselves, where did we come from? What does our past look like? And where are we right now? But more importantly, we also have to ask ourselves, where are we trying to go? We as a profession, you in training the next generation of NPs, but we also are a part of that process at High Yield Med Reviews. I mean, our purpose and our goal is to develop premier education that improves healthcare for good. And by helping you and partnering with you to improve the overall training and competency of the current next generation of NPs will allow us to be a participant in that, but also make it easy for you, because this can be sometimes a very difficult and daunting task. When you're standing at the base of this mountain and you're looking at that mountain, you're going, how am I going to get to the top of that? Right? I mean, it looks hard. It looks long. It looks confusing. It even looks scary at some level, okay? But we're going to make that easy for you, okay? But we're going to have to get oriented, and we're going to need a roadmap, okay? You're going to hear that word used again and again. But when you're moving forward, there are old tools, and then there are new tools. We need to be using new tools that also allow the current and even some of the future generation of learners interact with this material and get the goals that we're trying to achieve, okay? So sometimes the old ways of doing things aren't necessarily the best ways to continue to do them moving forward. And that's what we're going to kind of start to outline. So when we think about the past, I mean, NPs have been around for a long time. The profession has a long history, which is great. Going back even to the 60s, you know, key players in the profession. And then you had laws that started to change that influenced the opportunity for NPs to be able to really start to provide more care to the public. Now, we know that a lot of this was in the area of primary care and rural medicine in particular, but we know that that has continued to evolve, right? We've got family nurse practitioners, we've got geriatrics, we've got psychiatry, women's health, acute care now, emergency. All of these areas are expanding, and that's a great thing because we need nurse practitioners in all areas of healthcare to impact healthcare for good, don't we? But at the same time, in that evolution, a lot has changed. You look back at the number of new drugs that were being approved back in the 50s and the 60s compared to today. We all very aware that there are new drugs coming to market all the time, and sometimes it's hard to keep up with. Even looking at the number of drug companies out there have increased. So they're all vying for business and producing more drugs, and which is good because it gives us more options for our patients, but it also becomes inherently difficult to teach the current and the next generation all of this information. Because when you stop and you look at how many drugs are on the market today, there's over 20,000 individual separate medications and all these different dosage formulations out there for us to try to remember. No, we don't need to know every single one of those. We all know that. We don't prescribe 10,000 drugs in a week's time of different matter, right? But the relevance is that depending on where these nurse practitioners go, they need to be equipped, not just for today, but to maneuver in the moving changes within healthcare and the advancement of science and medicine for our patients so that we can continue to provide good patient care. So when we start thinking about design, you have to think about these essential components as it relates to teaching pharmacology at a more advanced level that gives people prescriptive authority and establishes that clinical competency where they're able to make good medical decisions for the patients that they're serving. So our current approach, most of us are familiar with, is that you have sort of the preclinical courses, your 3 Ps, right? Physical exam, pathophysiology, and advanced pharmacology. And then you have your clinical training. I mean, even medicine does that, even pharmacy at some level. It's very structured in a box, right? You finish this course and you move on, okay? But that's our current approach. But where a lot of professions, and including the NP profession itself, is moving is to this comprehensive, integrated, longitudinal, where you start to see a blending. It never really stops, does it? But that then becomes strategically difficult when you're implementing a curriculum where you traditionally at a class and you put things into particular buckets, right? So what are some of these key elements as it relates to advanced pharmacology that have to be considered in the design, integration, and delivery? Well, I mean, it's multifactorial. You have all these drugs that are being approved. You have all these drug companies on the market, producing all these drugs and bringing them to market. You have new molecular entities. You have biosimilars now happening. The biologic agents have proliferated over the last decade, and it's only going to increase. But you also have an aging population, which means more comorbidities. We're keeping people alive longer. It becomes a little bit more difficult to manage those patients sometimes. We also have, with that, growing number of drugs, drug interactions. We have the influence of pharmacogenetics and genomics. And then there's this thing called evidence-based medicine, evidence-based practice that has evolved going back to the EBM working group of 1992 that has permeated itself through all of healthcare. You've got to be able to strategically integrate all of these essential components into an advanced pharmacology curriculum, not just for today, but for the future. Now, when you stop and you think about it, you go, my head hurts. This is overwhelming, right? Some of the emotions that you see in these pictures are true probably right now, okay? I've been there, you've been there, we've all been there. But it can be done, especially if you have a partner, okay, that can help you do that and help you maintain it and keep it up to date, okay? So to achieve our desired endpoint, we have to know what is being expected of NPs now and in the future. We have to have a roadmap that gives us some guidance as to what does that look like, how do we practically implement that. We have to have now the tools to do it. And if you don't want to develop it, then you're going to have to get it from somewhere else that's a trustworthy resource that has years, decades of experience doing this, okay? And then we have to be able to join the journey and move forward. But it's not just about you or the institution or the curriculum itself, but it's also about the students. The students are expecting us as their faculty and educators to train them appropriately for today and also in the future. But wait a minute, it's not just about you. It's not just about the nursing student or NP student in particular, but it's also about the patients that they're serving. Don't those patients deserve that type of care? Don't we have a responsibility and a duty professionally, ethically to produce the right types of clinicians that can take good care of them, because these patients are entrusting their lives with us. We all know that. So this is important, and the decisions that we make and the orders that we write we know can impact someone's life. So the stakeholders that are entrusting us to do this and to do it right, okay, are, yes, the students, yes, the university itself. We have the general public, i.e. the patients themselves. We have the healthcare system as a whole. Okay, we know some of our outcomes haven't been great over the past decades when you compare to other programs. We've got to improve this. Okay, and then of course the state and federal government even connects reimbursements and payments to outcomes and performance. So how do we go from thinking like this in structured boxes where we compartmentalize sort of a topic and we don't bring it back up again, okay, to something like this? But I would like to raise even another question beyond this. Is this really the full picture? I like this arrow. I think it helps to visually capture the concept of comprehensive, integrated, longitudinal teaching of advanced pharmacology. But is this really the full picture? Is this really the end goal? Well, when you look at, does the profession have some sort of guidance for us? Like, to answer those questions, does it have it? And the answer is yes. In April of 2021, the AACN produced its Essentials document, which is the core competencies for professional nursing education. And it outlined the expectations of what is to happen from 3 years from that point, which is really turning the corner. It's approaching, it's coming fast. That's why the title of part 1 is, yes, we have change and it needs to happen for good reasons, but it's also imminent, okay? So starting in 2024, this becomes very real when it comes to curriculum being assessed and accreditation standards. So in closing and in summary of this first part, okay, if the profession is to stay ahead and continue to be relevant, then we have to move away from some of the older ways of doing things, and we have to establish a new roadmap and new way of doing it, but you also consider new tools, and that may require a partnership, okay? The AACN Essentials, like I said, were published in 2021 and gave a 3-year expectation to start to do this. So it's real. That means in 2024, it becomes very relevant, okay? If you want to stay ahead and for accreditation standards. Part 2 that we're going to address is, where are the essentials leading, right? What is the focus? What happened? What are some of these shifts in our mindset that are going to dictate not only design, but integration? But remember, we got to evaluate it and we have to maintain it. Okay? And again, in part 3, we're going to codify clear plans for how you can do that and explain how we can be part of that solution for you and make it easy so that it doesn't appear overwhelming. If you're already at that point of like, look, I already am sold, let's get started, okay? High Yield, thank you for doing this. Thank you for being a thought leader. I mean, I love this stuff. I've been teaching NP pharmacology for decades. It's important, okay? We need to do the right thing for the profession moving forward. So if you're convinced, we've been doing this for over 10 years, and we can make it easy for you, and we already have an established curriculum and program that you can either integrate, which we'll work with you to do, into your curriculum, or even the students can also purchase this, just no different than a textbook, right? Like the old tools versus the new tools, okay? If you want to see a demo, you want to hear some more, email us at customer support at High Yield Med Reviews, or you can scan this QR code and get more information. We are very happy to make this easy and explain it for you. Thank you again for joining part 1. Join us for part 2 and part 3 so that you can see the complete picture of how this all comes together for you.